Hello, everyone, and welcome back to MediInsights. Azathioprine is a decades-old immunosuppressant used to control autoimmune diseases and prevent transplant rejection. I'll explain when doctors use it, how dosing works, its mechanism, common risks, and practical safety steps you should know before you start taking it. Starting with use of Azathioprine Tablet. Azathioprine is prescribed to quiet an overactive immune system in conditions such as rheumatoid arthritis, inflammatory bowel disease like Crohn's and ulcerative colitis, certain autoimmune skin and blood disorders, and to help prevent organ transplant rejection. Doctors choose it when long-term immune suppression or steroid-sparing therapy is needed, and the benefits must be weighed against infection and blood risk monitoring. Next, dosage of Azathioprine Tablet. Typical maintenance dosing for adults is usually in the range of about 1 to 3 mg per kilogram per day, with many guidelines starting around 2 to 2.5 mg per kilogram per day and adjusting to response and tolerance. Transplant settings sometimes use higher initial doses, and dose adjustments are needed for liver or kidney impairment, so your prescriber will individualize the dose and monitor closely. Next, mechanism of action of Azathioprine Tablet. Azathioprine is a prodrug that converts to 6-mercaptopurine in the body and then to active thioguanine nucleotides. These metabolites interfere with purine synthesis and DNA or RNA formation in rapidly dividing immune cells, which reduces lymphocyte proliferation and dampens immune-driven inflammation. This is why it takes weeks to months to show full clinical effect. Next, side effects of Azathioprine Tablet. The most important adverse effect to watch for is bone marrow suppression, which can cause low white cells, anemia, or low platelets and raise the risk of infection and bleeding. Liver enzyme abnormalities and rare hepatotoxicity can occur, and pancreatitis is a known possible reaction, especially in some patients with IBD. Other common issues include nausea, fatigue, and increased infection susceptibility, and there is a small long-term increased risk of some cancers, so routine blood and liver monitoring is essential. Next, important advices for using Azathioprine Tablet. Before you start, tell your doctor about previous infections, current or planned vaccinations, pregnancy intentions, and every other medicine you take, because genetic testing for TPMT or NUDT15 can identify people who need much lower doses, and drugs like allopurinol can dramatically increase toxicity and usually require cutting the azathioprine dose. Avoid live vaccines while immunosuppressed. Get baseline and regular blood counts and liver tests, and immediately report fever, sore throat, unexplained bruising, severe abdominal pain, or jaundice. Thanks for watching and learning with MediInsights. If this video helped, please subscribe and leave a question or the drug you want next in the comments below, and we'll cover it in a future video.